Hi, I'm Caitlin White, and this is the room, the 360 view of the room that I am going to be doing my assessment in. All the way back around. And these are the items that I am going to be using along with the checklist to perform the exam. Hi, I'm Caitlin White, and I'll be performing a neurological exam on you today. This exam helps assess the function of your brain, spinal cord, and nerves. We'll be checking your cranial nerves, your coordination, your strength, and sensation. Do you consent to this?
Yes.
Great. Are you comfortable with me starting now?
Yes.
Okay, up first we're going to start with your cranial nerve 1, which is your sense of smell. I'm going to have you first check the patency of your nasal cavity. Can you close one nostril and sniff for me? Great. And do the other? Great. Your nostrils are equal and patent. Now I'm going to have you close your eyes, and I'm going to have you close one nostril. I'm going to have you smell two different items in each nostril, and I'd like you to tell me what they are.
Coffee.
Great. Now the other.
Peppermint.
Great. Your sense of smell is intact bilaterally. Now we're going to check your cranial nerve number 2. This is where we check your vision. First, I'm going to hand you the Rosenbaum chart, and I'm going to have you hold it at a comfortable reading level. I'd like you to cover one of your eyes and read the smallest line that you can from left to right.
3, 7, 4, 2, 5, 8.
Great. Can you change to the other eye?
3, 7, 4, 5, 2, 8.
Perfect. Now I'm going to have you have both of your eyes open and read the smallest line you can backwards.
8, 5, 2, 4, 7, 3.
Perfect. Your visual acuity is 20/30, OD, OS, and OU with correction. Now we'll check your visual field. Please keep your eyes fixed on mine, and I'm going to wiggle my fingers, and I'd like you to tell me when they come into your visual view.
They're there. Can see them. Can see. Can see. Can see. Can see.
Perfect. Your visual fields are full in confrontation. Now I'm going to check your pupillary response. I'm going to shine a bright light into your eyes, and I'm going to check for your pupils.
Okay.
Great. Your pupils are equal, round, and reactive to light and accommodation to near vision. This also tests the cranial nerve 3. Now we're going to be moving on to cranial nerve 3, 4, and 5. We're going to check your eye movements. Please keep your head still, and I want you to follow my finger with just your eyes. Great. Your extraocular movements are intact, conjugate, and there is no nystagmus. We're also going to test the convergence. Please watch my finger as I bring it towards your nose. Perfect. Convergence is intact. Now we're going to check the cranial nerve 6, which is the trigeminal nerve. I'm going to be palpating the temporal and masseter muscles to check for strength. Please clench your teeth when I palpate. Great. Perfect. I can feel a strong symmetrical contraction of the masseter and temporal muscles. Now I'm going to have you close your eyes, and I'm going to gently touch a part of your face with a cotton wisp, and I want you to tell me every time you feel my touch. All right, ready?
Mm-hmm. Feel it. Feel it. Feel it. Feel it. Feel it. Feel it.
Perfect. Sensory sensation to light touch is intact and symmetrical in all 3 divisions. Now we're going to do cranial nerve 7. Now I'm going to have you raise your eyebrows. Can you frown? Can you smile? Can I have you puff out your cheeks and don't let me push the air out? Perfect. Now I would like you to close your eyes tightly and don't let me open them. Great. Your facial movements are symmetrical and strong. Now we're going to do cranial nerve 8. I'm going to rub my fingers on either side of your ear, and I want you to tell me what side you hear it, left, right, or both. Can you close your eyes for me?
Left, right, left, and right.
Perfect. Your hearing is grossly intact and bilaterally. Now we're going to do cranial nerve number 9 and 10. This is where I check your gag reflex, voice quality, and soft palate. But for the sake of this test, I'm not going to test your gag reflex. We'll just say it's intact.
Okay.
So I'm going to shine a light into your mouth, and I'm going to have you say ah. And I'm going to check your uvula. Perfect. Your gag reflex is intact, your voice is clear, your uvula is midline, and your soft palate rises symmetrically. Now we're going to move along to cranial nerve 11. I'm going to have you shrug your shoulders against my resistance. Great. And now move your head against my resistance. Now this side. Perfect. Your shoulder shrug and head turn are strong and symmetrical bilaterally. Now we're going to do cranial nerve 12. This is testing your tongue. So can I have you put your tongue out straight? Can you move it side to side? Perfect. Your tongue is midline with no deviation and moves symmetrically. Now we're going to test your coordination. First, we're going to start with your upper body, your upper extremities. I'm going to have you please pat your thighs as quickly as you can, alternating your palms up and down. Perfect. Now we're going to be doing the point-to-point test. I'm going to have you touch your nose and then touch the tip of my finger as I move it.
Okay.
Perfect. Your upper extremity coordination is intact and smooth bilaterally. Now we're going to move along to your legs. Can you please tap your feet on the floor as fast as you can? Okay. And then can I have you take the heel of your left foot, and I would like you to drag it down, or can I have you take your heel of your left foot and run it down the shin of your right leg? And now the other side. Perfect. Your lower extremity coordination is intact and smooth. Now for this part of the exam, I'd like you to stand up, and I'd like you to walk across the room so I can assess your gait. Okay, can you come back with a heel toe? Perfect. Now walk on your toes. Perfect. And now your heels. Are you able to jump up and down on one leg? Now the other. Perfect. Your gait is normal and your balance is stable. Now I'm going to check your stance. I would like you to stand with your hands to your side and your feet together and close your eyes. I'm assessing for any movement or any swaying that would indicate a positive Rommenberg sign, which she does not have, so she has a negative Rommenberg sign. Next, I'm going to check for pronator drift. I'm going to have you put your hands out with your palms up and close your eyes. Great. There is no pronator drift, and your arms remain in place. Now we're going to test the motor systems. We're going to first do your upper extremities, and I'm going to test your reflexes. So I'm going to have you put your arm up, and I want you to extend your arm against my resistance, and now pull in. Perfect. Now the other arm, push out, and pull in. Great. And now I'm going to have you put your hands out in front of me, and I want you to push up. Now don't let me push you down. Perfect. And please squeeze my fingers. All right, can I have you put your hands out like that, and don't let me squeeze your fingers inwards. Perfect. Now I would like you to encircle your thumb and your pinky finger, and don't let me pull them apart. Now the other side. Perfect. Your upper body strength is 5 out of 5 and symmetrical bilaterally. Now we're going to do your lower extremities. Can you have you sit down for this? Okay. All right. For this, I'm going to have you push up against my hands. Now push down. Great. I'm going to have you push inwards. Now out. Great. And now I'm going to have you push out. going to have you push against like you're pushing a pedal. Now pull. Great. Push up. Or like you're pushing the pedal and up. Thank you. Your strength, your lower extremity strength is 5 out of 5 and symmetrical. Now we're going to move along to the sensory systems. This is where I'm going to check your sensation. I'm going to use a cotton ball for light touch and a sharp and dull object. And I'd like you to tell me what you feel and where you feel it when I do it. I'm going to kind of test it randomly so you can't suspect where I'm going to be touching you at. Take this. All right, close your eyes.
Sharp right chest, dull right thigh, dull left thigh, soft right leg, soft left leg, sharp left leg, sharp right leg, dull left arm, sharp left arm, sharp right arm, sharp left chest, soft right arm.
Great. Your sensation to light touch and pain are intact and symmetrical. Now we're going to do some special tests. This is the pre-perception test. I'm going to move your toe up and down, your big toe up and down, and I want you to tell me what position it is when I stop. This is up and this is down.
Okay. Down.
Okay.
Down.
Great, good job. Your pre-perception is intact bilaterally. Now I'm going to do the vibratory sensation. Please keep your eyes closed for this test, and I'm going to place a vibrating tuning fork on your big toe and your finger and tell me when the vibration starts and stops. I do not have a tuning fork, so we're going to pretend for this one.
Stop. 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 Stop.
The vibratory sensation is intact. For the discriminative sensation, for this next test, I'm going to have you continue to keep your eyes closed, and I'm going to place familiar objects in your hand, and I want you to tell me what it is.
A key.
Okay, the other hand.
Quarter.
Yep. Good job. Your, that's correct. Stereogenesis is intact. Now I'm going to draw a number in the palm of your hand. I want you to close your eyes, and I want you to tell me what number I'm drawing.
5.
Okay, and the other hand.
9.
Great. Correct. Aesthesia is intact. Now I'm going to touch 1 or 2 points of your arm, and I want you to tell me if you feel 1 or 2 points. Close your eyes.
Yes. Yes. Yes.
Okay. Correct. 2-point discrimination is intact. Now I'm going to touch you somewhere on your body, and when you open your eyes, I want you to point where I touched you. Great. And now I'm going to have you close your eyes again, and I'm going to touch you on 2 separate points of your body, and I want you to open your eyes again and tell me where I touched you. Great job. Your extinction is not present. So now for this part, we're going to do the meningeal signs. I'm going to have you lay down. I'm going to have you lay on the table, and this will assess for any meningeal irritation. For this first sign, I'm going to flex your neck, and I'm watching for any involuntary movements of your hips or your knees that would be a positive Bruinski sign. So I'm going to flex your neck. Great. You have a negative Bruinski sign. Now we're going to do the Koenig sign. This is where I flex your knee and your hip, and I'm going to extend your knee. I'm watching for any pain or resistance. Great. Great. Negative Koenig sign. For this last one, I'm going to do a negative, or I'm going to do a straight leg rise. I'm going to be looking for any shooting pain down the leg. So I'm going to raise your leg and tell me if there's any pain.
No. No.
Perfect. That is a negative straight leg raise. You could sit up if you want. Now I'd like you to extend your arms out like you're stopping traffic. With this, I'm looking for any wrist flapping that would indicate astrixis, but she is negative for astrixis. Now to complete the last portion of our exam, we're going to be starting the deep tendon reflexes. We're going to first start with upper extremity. And I'm going to start with the bicep. I'm going to have you hold your arm out. And then for this, I'm going to hit my hand. Good. And now I'm going to do the brachioradialis. Great. And now I'm going to do her tricep. I'm going to have you just hold it there, kind of relax it, wiggle, wiggle. Great. Now this arm. I'm going to do the bicep. Great. And then I'm going to do the brachioradialis. Great. And now I'm going to do the tricep. Great. Your upper extremities DTRs are 2+ and equal bilaterally. Now I'm going to do your lower extremity DTRs. First I'm going to do your patellar reflex and strike your knee. And now this one. Great. And now I'm going to do your Achilles. Perfect. Your lower extremities DTRs are 2+ and equal bilaterally. For this last test, they are the cutaneous simulations. This is where I check your cutaneous reflexes of your abdominal reflex. So I'm going to stroke your abdomen in an X pattern towards your umbilicus, and I'm just looking for any reflex.
Where do you want me to sit? I'm just kind of lay
Yeah,
back.
lay back,
Okay.
that's fine. Alright, I'm gonna just lift up your shirt, I'm sorry. Alright. Great. Your abdominal reflex is intact. Now I'm gonna do your plantar reflex. I'm going to stroke the lateral aspect from the sole to the ball of your foot. Excellent. Great. Your plantar reflex is downgoing with a no Babkin sign. This is the conclusion of the neurological examination. Everything appears to be within normal limits. Do you have any questions for me?
No.
Thank you.
For your exam.